My exposure to medicine began at an early age. I remember sitting with my dad, watching TV as he underwent hemodialysis treatments. I remember going with him to a doctor's appointment where he had staples removed following a kidney transplant. He ended up back on hemodialysis, a second kidney transplant, and ultimately underwent a below-knee amputation. And while these are unfortunate circumstances, I feel like they had a positive impact on my life and allow me to connect with my patients. For me, the most important thing happens outside of the operating room, and it's the education, it's talking with the patients. One of the most rewarding things is when a patient can either explain to me or their family member what's going on and what the plan is, and then relay everything in an accurate manner so that when surgery comes and when we're dealing with these problems, the actual plan is clear and the potential risks are also understood so that there's really not a lot of surprises along the way. One of the beauties of vascular surgery is it's very diverse and there's a lot of pathologies and a lot of problems. But within that, I find myself gravitating towards limb salvage type of work. We're able to use a lot of these new devices and many times patients who would have absolutely been committed to an amputation, we have multiple sort of last ditch efforts that we can try that work in many cases. And so we are absolutely doing less amputations than we were before. I'm Kyle Markel, I'm a vascular surgeon, and I'm passionate about educating my patients to try to help navigate an unfortunate situation and leave with a positive life experience.